हेलो गाइस, वेलकम टू माय चैनल AriYa नर्सिंग एजुकेशन। आज हम डिस्कस करेंगे नर्सिंग प्रोसेस। फंडामेंटल ऑफ नर्सिंग का एक इम्पोर्टेंट टॉपिक है नर्सिंग प्रोसेस, जिसके बेसिक पर पूरा नर्सिंग क्या डिपेंडेंट होता है। लेट्स डिस्कस द टॉपिक। नर्सिंग प्रोसेस। नर्सिंग प्रोसेस क्या है? नर्सिंग प्रोसेस is a critical thinking process that professional nurses use to apply the best available evidence to caregiving and promoting human functions and response to health and illness. It was defined American Nurses Association 2010. Then it is a systematic and dynamic method of providing care to patient, whether the patient is an individual, group, family or community. Then discuss purpose of nursing process. First, to identify a patient's health status and actual or potential health care problems or needs. Then to establish plans to meet the identified needs. Then to deliver specific nursing intervention to meet those needs. Then discuss steps in nursing process. These are classified into 5 steps. First, assessment. Second, nursing diagnosis. Third, planning. Fourth, implementation. 5, evaluation. Then assessment, scientific method, asks question. Then nursing diagnosis, scientific method, identify problem. Then planning, scientific method, hypothesis. Then implementation, scientific method, experiment. Then evaluation, scientific method, analyze or conclusion. Then explain the steps of nursing process. First discuss assessment. Assessment involves the collection of data to determine actual and potential problem of the patient, and it begins with nurses' first encounter with the patient. Then discuss types of assessment. These are classified into 4 types. First, initial nursing assessment. Second, problem focused assessment. Then third, emergency assessment. Then fourth, time lapsed reassessment. Then discuss first assessment, initial nursing assessment. Initial nursing assessment is performed within specified time after admission. Then to establish a complete database for problem identification. For example, nursing admission assessment. Then second assessment, problem focused assessment. Problem focused assessment to determine the status for a specific problem identified in a earlier assessment. For example, hourly checking of vital signs of fever patient. Then third assessment, emergency assessment. During emergency situation, to identify any life-threatening situation, for example, rapid assessment of an individual's airway, breathing status and circulation during a cardiac arrest. Then fourth assessment, time-lapsed reassessment. Several months after initial assessment, to compare the client's current health status with the data previously obtained. Then discuss types of data assessment. These are classified into 2 types. First, subjective data assessment. Second, objective data assessment. First discuss subjective data assessment. Subjective data assessment means feeling, sensation and perception obtained through patient's interview. These are the patients given information about example, symptoms of disease like pain in the abdomen. Then discuss objective data assessment. Objective data assessment means these are the observation or measurements regarding patient's health status. For example, signs of disease like jaundice, bleeding, etc. Then discuss source of data. First discuss primary source of data. It is the direct source of information. The patient is the primary source of data. Then discuss secondary source of data. It is the indirect source of information. All sources other than the client are considered secondary sources. Basically, family members, health professional, records and reports, laboratory and diagnostic results are secondary source. Then discuss second nursing process, nursing diagnosis. Nursing diagnosis is the second phase of nursing process. Nursing diagnosis is the statement of actual or potential problem of the patient. Nursing diagnosis is written for the physical, emotional, social development, intellectual and spiritual aspects of the patient. Then NANDA define nursing diagnosis. NANDA full for North American Nursing Diagnosis Association. These are four types of NANDA nursing diagnosis. First, actual diagnosis. Second, potential diagnosis. Third, health promotion diagnosis. Fourth, syndrome diagnosis. Then explain types of nursing diagnosis. Then discuss first type, actual diagnosis. Actual diagnosis is also known as problem focused diagnosis. It is a client problem that is present at the time of the nursing assessment. For example, ineffective breathing, anxiety, acute pain, etc. Then discuss second type, potential diagnosis. Potential diagnosis is also known as risk diagnosis. Risk nursing diagnosis describe human response to health condition that may develop in a vulnerable individual, family or community. For example, risk for fall, risk for injury, risk for pressure sore, etc. Then discuss third types, health promotion diagnosis. Health promotion diagnosis is also known as wellness diagnosis. Clinical judgment about motivation and desire to increase well-being. For example, readiness for enhanced spiritual well-being, readiness for enhanced family coping. Then discuss four types, syndrome diagnosis. Clinical judgment concerning with a cluster of problem or risks nursing diagnosis that are predicted to present because of certain situation or event. For example, chronic pain syndrome, post-trauma syndrome, etc. Then discuss third nursing process, planning. Planning is to formulate the way to manage the problem. The third step of the nursing process includes the formulation of guidelines that established the proposed course of nursing action in the resolution of nursing diagnosis and the development of the client's plan of care. Then goals include prevention, rehabilitation and address the crisis or urgent needs of the patient. Then discuss steps of planning. These are classified into three steps. First, initial planning. Second, ongoing planning. Third, discharge planning. Then explain steps of planning. Then discuss first steps, initial planning. planning. The nurse perform admission assessment in order to prioritize problems, identify goals, and coordinate nursing care to resolve the problem. Then discuss second steps, ongoing planning. It involves continuous updating of the client's plan of care. Then third steps, discharge planning. It involves anticipation and planning for the client's needs after discharge. Then discuss elements of planning. First, prioritizing the problems or nursing diagnosis. Then formulate goals or desired outcomes, basically short term and long term. Short term means to resolve in few hours or days. Long term means to resolve over weeks or months. Then select nursing intervention. Then write nursing intervention. Then discuss fourth nursing process, implementation. Implementation consists of doing and documenting the activities that are the specific nursing action needed to carry out the intervention or nursing orders. It provides the actual nursing activities and client response. Then discuss nursing skills during implementation. To implement nursing care plan successfully, nurse need to have the following skills. First, cognitive skills. Cognitive skills including problem solving and decision making. Then second, interpersonal skills. Interpersonal skills includes verbal and non-verbal response communication. Then third, technical skills. Technical skills includes hand-on skills need to perform procedures such as administering injection, drugs, lifting and moving. Then discuss fifth or last nursing process, evaluation. Evaluation is the last phase of the nursing process which includes the judgment of the effectiveness of nursing care to meet client goals based on the client's behavioral response. This step determines the success or effectiveness of the whole nursing process, and the decision either to continue, modify or repeat the processes depend on evaluation. Then it's determined whether the patient goals have been met, partial met or not met. So this was nursing process. I suggest you आप लोग मेरा वीडियो फर्स्ट से लास्ट तक देखिए, क्योंकि आपको इजी होगा नर्सिंग केयर प्लान बनाने के लिए. आप नर्सिंग केयर प्लान अच्छे से सीख जाओगे. I hope you understood this video. Any doubt, please comment me on comment box. Then I will clear all doubt. आप चाहे तो मेरा टेलीग्राम चैनल ज्वाइन कर सकते हैं, लिंक आपको डिस्क्रिप्शन पे मिल जाएगा. If you understood this video, then please like, share and subscribe my channel. Thank you for watching.